Hi, welcome everyone. My name is Jennifer Byers. I'm the Executive Director for Life with Cancer and Patient Experience in Northern Virginia at the Inova Share Cancer Institute. I'm excited to be here today to talk about sex matters and sex and lung cancer. So we will go ahead and get started. If I can figure out how to change the slide. There we go. So what are we going to talk about today? We're going to define sexuality and intimacy. We're going to dispel some common myths that come up. We are going to spend some time talking about the effects of cancer on intimacy, ranging from how treatment impacts it as well as the emotional impact, and also go over some suggestions or ideas for how you can maintain intimacy, try different things, and really make sure that intimacy still is a part of your life. And we will talk about this for people who are partnered, but also for people who are single as well. So what is the prevalence of sexual dysfunction for people who have been impacted by cancer? We know that about 40 to 100% of people who've been diagnosed with cancer will experience some sexual problems. And I like this stat, not because I want everyone to think that they're going to be impacted sexually by their cancer, but just to really normalize that really, when we talk to patients, it's hard to find anyone who hasn't had some impact to their sexual health. And it's not something that we talk about a lot. It's not something that physicians bring up a lot, but it really is an important part of people's experience. More and more people are living with cancer as a chronic illness. And so it's important that we talk about quality of life issues like sexual health. There we go. All right, so when we talk about sexuality, we're not just talking about the act of sex. Oftentimes when people think about sexuality, they think about intercourse, penetration. But today when we talk about sex, I want us to try to think broader about this. I want us to think about the way we feel about ourselves as sexual beings, the way we express our sexuality. And there are physical aspects to that and non-physical aspects. And we all differ so much in that, but simple things like the clothes you wear, the way you move, cultural and religious values, the way you have sex and who you have sex with, those all make up our sexual identity. And a big part of why our sexual identity can be impacted by a cancer diagnosis is that it impacts so many parts of ourselves. So intimacy can be defined as a reciprocal relationship in which innermost thoughts and feelings are shared, and it can include areas such as sexual or emotional. And it's important that when we're talking about sexual health that we include intimacy in the conversation as well, because it's a big part uh, of, of a person's sexual experience. And why is sexuality so important? I think when we think about this, it signals to people I'm alive, I'm a human, oftentimes acceptance and validation of a partner. And a lot of times I hear from patients that resuming sexual intimacy is one way to feel normal, to not feel like you're other or different, and also to not feel like cancer has taken this piece of you away. And so it's an important thing to make sure that there is communication around. Oftentimes we think sexuality and intimacy are not life or death issues, and that's oftentimes true. You know, this isn't something that's going to kill someone, but it is a very real quality of life issue. And quality of life is what we live for. It's the reason that we get out of bed every day. And so wanting to make sure that sexuality gets as much attention, maybe not as much attention, but it's important as physical health, and it's important for quality of life. I think it's always to use a little bit of humor when we're talking about sexual health, and so I wanted to include this cartoon. Oftentimes I think we think that we can just take a pill and things will get better, but sexual health is so much more broad than the physical component. There's a large physiological component, and so oftentimes taking a pill isn't going to make the issue go away because it tends to be much bigger than that. So what are some myths when we think about sexual health? I hear from a lot of people that sex is failure without orgasm. This doesn't apply to me. I'm single. My partner will think less of me. I'm less of a man or a woman. I'll never be able to satisfy my partner. And these things really don't tend to be true. I think oftentimes after a cancer diagnosis, we have to get really creative. Things may look or feel different than they felt before, but sex and intimacy can still be a really large part of a person's life, even though it may not look exactly like it looked before. I think if any of us think back to our 20s, sex may have looked really different back then as well, but that doesn't mean that it's bad as you get older. It just means that it's different. And that can be really similar after a cancer diagnosis. It's not necessarily that things are bad, they just may need to be different than they were before. And spending some time to think about how they can be different can be hard, but it can be an important part of getting back to some piece of sexual health and some part of intimacy. So there was one study that showed that 52% of patients with lung cancer reported at least mild sexual concerns. And these sexual concerns are just as prevalent in those impacted by lung cancer as they are for breast and prostate cancer patients. And oftentimes when someone thinks about lung cancer, they may think, well, why would that impact sexual health? It's not in a sex organ, and so it shouldn't have a big impact. But what we see in the literature and what we know to be true is that it certainly has an impact. And some of that comes from the shortness of breath people experience. Some of that comes from the emotional distress that's associated with a cancer diagnosis. But there's also a lot of other issues that can come up, like fatigue or medications that people are on. And so it is a very normal thing to have sexual health impacted in people who've been diagnosed with lung cancer. Oftentimes, because lung cancer can be palliative in nature, clinicians may assume that sexual concerns are unimportant. But data suggests that really that is not the case, and it is something that patients often want to bring up with their physicians. If we were in a room together, I would love to hear feedback on if people have brought this up with their physicians or how conversations can go. And while we can't necessarily have that conversation here today, it can be helpful to think about what would you want that conversation to look like with your physician, because sometimes it's important for patients to bring it up because doctors aren't always having it on their list of things to discuss. And also when we look at some of the literature out there, we see that couples with lung cancer describe some positive effects and some negative effects on intimacy. The negative impact generally comes from treatment, including physical and psychological effects, but there are positive impacts too. that include an increase in non-sexual physical closeness and appreciation of the spouse or caregiver. And so this idea that only bad things can come is not necessarily true, and we don't see that in the literature, that there are some good things that can come from a diagnosis. And intimacy has also been shown to be beneficial for couples' psychological adjustment to illness. And so this idea of feeling close to your partner, feeling close to people who are helping care for you, can be an important part to adapting to an illness. All right. Just trying to monitor the chat and the slide. So. Okay. Trying to get to my next slide. There we go. So what is the impact of cancer on our sexual response? Oftentimes we may see that show up as impaired sexual arousal. So for women, that may look like a lack of lubrication or dryness or vaginal discomfort. For men, it could look like an erectile disorder. For both men and women, oftentimes we hear of a lack of subjective pleasure. So maybe things feel different, or they don't feel like they used to, or desire feels a little different. And that can be true with orgasmic function as well, that people may have difficulty reaching orgasm, or that the intensity of an orgasm may feel different. And then loss of a libido or pain during sex are also things that impact the sexual response cycle that we hear oftentimes from people who have been impacted by cancer. Other things to keep in mind that could have an impact, some of the side effects, so surgery and skin irritation, if there's a part of your body that is more sensitive or more painful, that can impact sexuality and intimacy. There may be a disinterest, especially at the beginning of a cancer diagnosis. There's so much happening. There's so much new information. There's so much you're learning about treatment that may really be all consuming in your life. And so sexual health may very well take a back seat at different points in the cancer trajectory. Fatigue is a really big one. And we'll talk a little later about some strategies to combat fatigue. But when we're tired, we don't often feel like having sex. And so feeling fatigue can have a large impact on sexual health. Social life changes or role changes can be something that has to be navigated. So oftentimes, if it's a partnered relationship, the caregiver may be doing a lot of caregiving for the patient. And if we're doing a lot of caregiving, the role changes a little bit, and the person who's being cared for may not feel as sexual because they're having to be taken care of, or the caregiver may feel less attracted because they're in a caregiving role. And so really finding ways to define when that caregiving role is happening and when we're in a more partnered sexual role. Fear of recurrence can have a big impact on sexuality and feeling sexual. Negative self-perception, so we think about our body image, loss of hair, scars, all impact how we view ourselves and how we think about ourselves. And so really needing to take some time to get used to a new body image, or to find ways to play around with some of those changes. Anxiety and depression, we know that 15 to 20% of people diagnosed with cancer are going to have increased anxiety and depression, and that's true for our caregivers as well. And anxiety and depression can really impact desire and libido, and the medication used to treat it can also impact that. As well as sometimes we see an increase in smoking or alcohol use, and that can affect erection difficulties, lack of interest, and it affects women as well. So what are some common concerns that I hear from folks, and maybe some suggestions to kind of counteract those? I talked a little bit a minute ago about antidepressants, but we know that antidepressants may delay orgasm or create an ability to not have an orgasm. And so sometimes, depending on someone's depression or anxiety, we may want to look at if a dose reduction or a medication change can help. And this isn't something that everyone can do, but it's if your antidepressant is impacting your sexual health and that feels very important to your quality of life, it would be a good thing to bring up to either your oncologist or the person who's prescribing that medication to you to see if there's another medication that you can try, or if there's a reduction in medication that would be helpful, or perhaps even if there's another medication like Viagra that you could layer on top of it that would help with that. Loss of desire. So when we think of loss of desire, the first thing we want to look at is depression, because depression can certainly lead to a lack of desire. And like I just said, it kind of creates a little bit of a vicious cycle, because if you're depressed, oftentimes you may use medication for that, and medication can also lead to a loss of desire. But knowing the difference between fatigue and depression and playing around with different treatments for that is going to be a really important piece of getting back towards sexual health and intimacy that feels good. And then I also talked about already changes in body image. One tip to combat body image changes is really to use positive affirmation. So are there parts of your body that still feel sexy and sexual to you? So perhaps you have a scar that you don't like. Maybe you use something to cover that scar, but there's some other part of your body that still feels very sexy to you, or still is very important to you. Or maybe it's that you're a really funny person or a really smart person. And so working on positive affirmations that make you feel sexy, that are really outside of where that body image is impacting you. And then this idea of who am I now? Cancer can really cause people to ask this question, if you can't work like you used to work, or you can't take care of your kids like you used to take care of your kids, or if there's different ways that cancer has impacted kind of how you see yourself, then it may be important to sit down and really think about what are the pieces of you that are still there that were there before. Maybe you can't do things that the way you used to do them, but there's still things that you are able to do, and really not taking like a point of view that these things aren't important, or be happy or everything's okay, but really looking for what are the positive things and making sure that you are focusing on those. And that doesn't mean that the negative things aren't there, but sometimes we can get caught in a negative loop of only focusing on the negative things without paying attention to the positive things. And we know that that can really impact desire and the way that we see ourselves. Pain and fatigue is something that comes up a lot as well. For some people, sex may not be important to you. You're probably not in this lecture if that's the case, but know that if it's not important to you, then it's okay. Like, that's not something you need to worry about. But if it is something that's important to you and you're experiencing pain and fatigue, there are some ways that you can navigate that. One thing would be to plan for the time of day that pain is the weakest, or when you're most refreshed. So maybe you always had sex in the evening. It may be a good idea to look at morning sex or sex after a nap when you're more refreshed, or doing it in the window when your pain medication will be working the most. It's okay to position yourself more comfortably. So using pillows as props, using lubrication if you need that, but not trying to recreate how you had sex before, but really looking for the new ways to make sex comfortable now. There are deep breathing and relaxation techniques that can be helpful. I imagine everyone has heard of mindfulness and meditation. So there are specific mindfulness and meditation practices that you can use either to increase desire, like a sexy meditation, or really just to relax your body. So when we are worried about pain, we tend to clench up our muscles, which leads to more pain. And so really making sure that you are getting into a very comfortable position and relaxing yourself and your muscles as much as possible. Foreplay and massage are so important, really not rushing to the main event. And oftentimes I really encourage people to not think of a main event. Orgasm or penetration can be a really small part of sex, but that there can be an entire lead up to that can be equally important for intimacy and feeling sexual. And so sometimes people won't have penetrative sex, or they won't even try to get to orgasm, but really enjoying that foreplay, enjoying being with a partner, taking that time for just touching the body in different ways can be really key and important. And then this idea to take time just to be naked or use sensate focus exercises. I'm not going to have a lot of time today to talk specifically about sensate focus, but certainly you can find it online, or One of the resources would be to reach out to a sex therapist after the presentation to get more information. But Sensate Focus is really a nice way to just learn your body again, to not have the pressure of having penetrative sex or orgasm, and to use different types of touch to learn what you like as your body's changing. Redefining sex and expectations. I just talked about that a little bit. Alternative forms of sexual gratification can be important, whether that looks like oral sex, looking at sex in a different way, but really being creative can be important. Communication is super, super important. One, for increasing desire, but two, just to really know where people stand. And I have a few slides coming up on communication that I think will be important. And then using masturbation exercises or a vibrator can always be helpful. After a cancer diagnosis, after surgery, after new medications, oftentimes the body is changed and it's different. And it's really hard to communicate what you like if you don't even know that yourself. And so spending some time with yourself to learn your body again can be key to feeling comfortable when you're with a partner. So how do you talk to your partner about sex after cancer? You want to tell your partner how you feel about your sex life and what you would like to change. And this could be either for caregivers or for patients, but talking about what's happening in your sex life, your thoughts and beliefs about why your sex life is the way it is, how you feel, and what you think would make you feel better. I'm going to show a script on the next slide, but really using this 4-step communication technique can be really helpful, because oftentimes when we have communication, if we're not careful of how we're communicating, it may feel like we're blaming someone. And when we blame people, they shut down and don't engage. And so talking about things from your own perspective and how you make it feel, how it feels to you, can be really key. So here's an example of this. It goes from fact, belief, feelings, and needs. So the fact: we have made love only a few times since my cancer treatment. I think it may be because you're afraid of making me feel uncomfortable. When we do not have sex, I feel very lonely and I miss being close to you. Sometimes I also feel angry that cancer affects our sex life too. And I would feel much better if we had sex more often and if it was your idea more often. And so you could put this, I mean, it could be about a lot of different things, but really this idea of starting with a fact, following it up with your belief, talking about how it makes you feel, and then having some suggestions for problem solving can be really helpful when communicating about really anything, but today we're talking about how you can communicate about sex. Also helpful is repeating what your partner says in your own words, making sure that you're understanding it. We all come to things from our own perception, and so sometimes if we're not careful, we may mishear things or maybe misintend how they were supposed to be. Asking questions to show interest and caring, showing support, and really listening, not necessarily being so worried about how you're going to respond, but being certain that you're listening and having open dialogue. And we've talked a little bit about how Sensate Focus. So other tips that can be helpful for pain and fatigue, or if you're having difficulty, changing sexual positions can be good. Experimenting with different positions can be helpful if the position that you most often try or utilize is painful or uncomfortable. Wearing a condom within 48 hours of treatment, communicating, which we've talked about, setting boundaries between couple time and caregiving time. I mentioned that a little bit earlier, but oftentimes caregiving can really bleed into couple time. And so making sure that there's more clear boundaries can be helpful in really delineating when someone doesn't want to always feel like a patient and a caregiver doesn't always want to be caregiving. And so really trying to separate those things when possible. And then there's always the option to see a therapist to help work through some roadblocks. I think communicating about sex, if it's not something you're used to doing, can be really uncomfortable. And so working with a therapist or someone who has experience to help couples, but also individuals, figure out where they are, how they're feeling, and how to use the words to express that can be helpful. I wanted to just take a minute to talk about caregivers, and I've mentioned them a few times throughout this presentation, but oftentimes caregivers think um, that they shouldn't be allowed to talk about their own desires, or that it's selfish or insensitive to think about themselves. And really, if sex is important to you as a caregiver, it's an important thing to bring up. I think in almost all relationships, there's a mismatch of desire. I don't know that I've ever worked with a couple where they both have the same amount of desire. And so meeting in the middle or coming up with compromises is always a really important part of sexual health dialogue. But you can't do that if you're not communicating about your own desires. And sometimes it may take some creativity, but really starting the conversation can be important. And oftentimes people find that their partner wanted to have the conversation too, but maybe felt uncomfortable bringing it up. And it can be an elephant in a room if no one's willing to bring it up. And just importantly, to make sure that you're asking questions of your partner and healthcare staff, and showing affection in a relaxed way to show you're still interested can all be important pieces. So when you want to find other ways to be sexual, you want to go slow at first, create a sensual mood, lighting, music, scent, schedule a date, ask for more foreplay, find ways to feel more sensual, and tell your partner about your worries and fears. So all of these really are about communication. And for folks who have been partnered for a long time, they may have had a sexual dance that worked for them. And so it's a significant change when they have to think about things differently or do things differently. And so it's almost like thinking back again to when you were first dating and you didn't necessarily know what your partner liked, or things were new and exciting. You could think of this as a new and exciting time as well, that you're getting to know each other again, you're getting to know each other's bodies again, and likes, wants may have changed. And so really paying attention and allowing some space for that. As well as for single people, getting to know their bodies and playing around with and learning what they may share with partners first and upfront, and maybe what they may share down the line can be an important piece. And that all goes back to learning how to talk about this. And sometimes we need a little practice. When I talked about earlier this idea of putting some delineation between caregiving and being a patient, one way to do that could be to take a weekend trip away, which can help folks escape and relax. Creating that separation between being a caregiver or being a patient can really be helpful with desire, but it takes some nuances to play around with and figure out. Another thing to do is schedule time with friends. I think COVID has been such an interesting time for people who have been impacted by cancer, but also sexual health, because COVID has really impacted people's ability to leave the home, to hang out with other people. And oftentimes we get our sensuality, our sexuality from being fully into ourselves. And that may mean putting on nice clothes and going out, or spending time with friends and laughing, and being with people more than our partner, or being able to meet people if you're single. And those things have been very difficult to do during COVID. And because of that, that has a huge impact on people's sexual health. And so I think it will be interesting to see as things open up more and people are able to access vaccines, how that changes. But still, this idea of it's important to have a space outside of yourself, and all of that can impact how you feel sexually and how you feel in your body. All right, so I see that there's a lot of comments, and I haven't been able to successfully toggle between the presentation and the comments, so I'm going to hop up to those soon. But just a few things to remember is that appropriate timing of activity could be very important to increasing enjoyment. I can't stress enough the importance of getting creative. There's a lot of great things about being creative. One, excitement leads to feeling sexual, something that's different can be important, but also getting creative in that your body may not work how it used to work, and things that used to feel good may not feel good. And so really getting creative in how you are a sexual being will be important to be successful. Communication is key. When we feel safe and heard, we are much more likely to experience desire and to be in a successful sexual relationship. You can rest during sex. It doesn't have to be a marathon. And so maybe you have a sexy day or a sexy couple hours where you may have a bath, have candles lit, have some sexy snacks in the bedroom. There doesn't always need to be a goal to rush to orgasm or to rush to penetrative sex. And so making a sexy environment and taking time can be really important for intimacy and desire. Sex is not the only form of intimacy. So, I mentioned laying naked together, kissing, hugging. These are all important pieces of intimacy. And you want to be careful not to get into an all or nothing time frame or all or nothing headspace. So if we can't have sex like we used to, we shouldn't do anything. There can be a continuum of sex and sexual needs and sexual health. Patience and a sense of humor is so important. Things are going to mess up. Things aren't going to go well. And it's important to get into a space to be okay with that. And to know that if you try something today and it doesn't work, that doesn't mean never to try it again. And that finding the humor in some of the situation can really be helpful to take off some of the pressure. And skin is the largest sex organ, and the brain is the most important sex organ, and the possibilities are limitless. Oftentimes we get caught up in our head, and our head is a really important space. And so back to this idea of really creating positive affirmations or thinking about the parts of yourself that you feel are sexy can go a long way in actually feeling sexy and feeling desirable. So I'll just stop the presentation with this quote: "Intimacy need not end with cancer. You may need to redefine your ways of expressing intimacy, and you may need to experiment, because what worked before may no longer work after cancer." And so again, just this idea of being able to be creative and get outside of your comfort zone can be really helpful. So I'm going to stop there and hop into the chat and see what folks are saying. So hearing from some people that treatment made them not have a lot of desire, and unclear if it is related to medication or the brain doesn't want to go that route, but doesn't feel like they're really missing part of it. And that I think is really important to know. For some people, their sexual needs may change and it may not be something that they miss. And if you're a single person, great. If you're partnered, it would be important to have a conversation with your partner about it. But for some people, it doesn't feel like that big a deal, and that's okay. It doesn't need to become a big deal. It's when you want it to be different that it's important to see what changes you can make. All right. I'm having trouble scrolling down without everything disappearing, so bear with me and technology. Right, one person said, I feel that my husband is afraid can everyone see the quotes? I'm gonna see if Kristen can hop on. Can everyone see what everyone's saying? Yes.
Yes, I can see. So
I'm trying to see if there's any specific questions in here I need to answer.
So there are no specific questions. It was kind of just a lot of talk about how there is a lack of desire. One person said that they feel the husband is afraid he will, quote, break her. And then somebody mentioned, how about not wanting to get too close to partner or pushing away from partner to keep them from pain if I passed away?
Um, that's a great comment, and a really important thing to think about. But I think everyone figures that out for themselves and what they feel comfortable with. But there's going to be a loss regardless, and I think oftentimes in our effort to protect people from pain and loss, we may end up creating more pain and loss in the meanwhile. And so I think it's something to think about, but I also think it's an important thing to communicate about. This would be a good thing to talk to a partner about. I am really worried about causing you more pain if something happens to me, and really giving them an option to have some choice in the matter can be helpful. But this is something that can come up a lot, and fear of death and fear of reoccurrence and fear of things not going right really do have a big impact on sexual health. But having conversations around this can be really powerful, because oftentimes for partnered people, both people are thinking it, and by not talking about it, it just creates space and distance that maybe doesn't necessarily need to be there.
That's great. There is another person, Elizabeth mentioned that she had never had a UTI until a cancer diagnosis. Every precautionary method we've taken has still resulted in a UTI. He's now afraid he'll get me sick, and I don't want to get sick. It's really sad.
So this would be a great opportunity to bring the medical team on this. And if you've done that already, then it may be worth thinking about other ways to be sexual. Like I talked about, getting creative if penetrative sex is continually causing a UTI. I'm trying to think of what products could be helpful for something like this. But if this person wants to reach out afterwards, I may have a few other thoughts.
Great. And then, oh, sorry. Someone asked if you can direct them to find a sex therapist locally if they're in a small community. And is telehealth an option for a sex therapist? And does insurance usually cover that cost?
Yeah, great questions. So there's an organization called AASECT, AASECT, which is a great place to find certified sex therapists, and you can look for them by region. Telehealth is absolutely an option, and telehealth has really opened up things for people who live in smaller rural communities. Oftentimes, people will need to be seen by someone who is practicing in the state they live in for licensing rules, but some people may be licensed in a few states. And I don't know a sex therapist. I don't know a therapist who hasn't taken their practice to Zoom. And so, or Zoom may not be the platform, but any platform doing it online. So telehealth is absolutely an option, and AASECT is where I would go to find a certified sex therapist. And does insurance cover it? Yes. Insurance will cover sex therapy, but you'll need to find a specialist who takes insurance. But it can be covered by insurance. And so it's just a matter of finding the right therapist. I do think sex therapy, there is a smaller group of therapists. And so sometimes it can be harder to find someone who takes insurance, but it is out there. So I would start with AASECT, and then you can go from there. But it is a possibility. So it's definitely worth looking at.
Thanks. And then there's another question asking about hormone replacement therapy, especially when menopause and getting older is parallel with side effects of cancer treatment.
Yeah, so that's such a tough question, and it's a really individual one. I think you should absolutely talk to a doctor about hormone replacement therapy. For folks with breast cancer, this is a much more loaded question. But for people with lung cancer, there tends to be more options. And there are there's many types of hormone replacement therapy, but there is topical and there is systemic. And it very well may be that your physician feels completely comfortable with you using a hormone replacement therapy. And so oftentimes this tends to be a conversation between the oncologist and an OBGYN to really come up with the best recommendation and the best way to move forward. But it is really difficult when getting older is paralleled with a cancer diagnosis. And oftentimes it's hard to know the difference between what is normal menopause and what would be happening and what is being caused by the cancer. But I think hormone replacement therapy can be very helpful for some people, and it certainly is an option for some people. And so I would really encourage reaching out to your oncologist and an OBGYN to start having that conversation and look at what pieces of that they may feel comfortable with.
Thank you. And then one person mentioned that they had been married for 30 years and starting over is hard.
It is so hard. It is absolutely difficult, and I wouldn't be telling you the truth if I sat here and said that it wasn't. But it can also be extremely rewarding. And so I think everyone has to kind of think about where they are, but sometimes it really is worth uh, being creative and starting over and figuring out how to put the pieces together, because that intimacy can be a really important part of a relationship. And for some people, not having it really feels like a big hole, but it is not easy. That is so very true. And I'm glad that you said that.
I think that was all of the questions and comments from the chat, but thank you so much. This has been so helpful, and everyone appreciates you giving specific things that they can use in their lives to try to improve their sexual health.
Great. Well, it was a pleasure being here with everyone. And I hope that we can do this in person sometime and we can have a conversation, because I know sometimes it's helpful to be able to go back and forth. But I appreciate everyone taking the afternoon and the interest. And I hope you'll take one of the tips and go and try it. So
Thank you.
thank you.